So there's a few different ways that we can cope with something that's really stressful. One of them is to try to approach or eliminate that stress, the thing that's really worrying us. If you've got an assignment that is really stressing you out, you might work really, really hard to try to smash it out, finish it, get a whole lot of work done so that you don't have to worry about it anymore, okay? You might, on the other hand, spend some time at the gym, go for a walk, go play some Pokemon Go, anything to just get your mind off what's going on right now. Those sorts of things might be considered avoidance coping. The thing about trying to attack the problem and solve it could be considered approach coping. So any attempts to maybe problem solve or try to think optimistically about the problem, try to be in control of the stressful situation and fix it is considered approach coping. And any attempt to ignore or avoid the stress and maybe deny it or withdraw away from people or the problem, that's considered avoidance coping. If we think about this with respect to health problems, things like if you're struggling with obesity or with heart disease, going for a walk or a run, hitting the gym, that might be considered approach coping. Switching off by watching TV, spending extra time at work, maybe just not trying to think about it, those sorts of things can be considered avoidance coping. As was kind of described in the definition of coping, strategies can be either cognitive or behavioral. Cognitive strategies mean they're things that you kind of think about. So one sort of cognitive strategy might be problem solving, trying to think about ways to get around the problem and fix this thing that I'm trying to deal with. You could be trying to think about the positives of the situation. Maybe if you've been told that you have to have a health condition that means you spend more time at home, a cognitive type of coping could be say, well, at least I get to spend more time with the family, maybe, okay? These are cognitive things because they're things that you don't actually have to do with your hands and feet. They're things that happen up here, okay? A different type of coping are things that you have to do with your hands and feet. They could be ways that you either approach or avoid with your body, okay? So a behavioral strategy could include seeking guidance or support from friends and family, okay? Going and asking them, mate, look, I really need some help and I really need to talk about this. It could be taking action toward fixing the problem. Taking a medication might be considered a behavioral approach strategy. But behavioral strategies can be avoidance too, okay? They can be trying to run away from the problem or spend time watching TV. Those sorts of things might be considered avoidance because you're trying to do something with your hands and feet to cope with the problem, but you're not necessarily doing anything towards fixing it. You're trying to do something away from the emotions around it. Some coping strategies are considered problem-focused, which are like approach strategies, right? They're trying to solve the problem, fix it, plan, ask for help, put more effort into trying to, say, complete your assignment. That would be considered a problem-focused strategy. Other strategies are considered emotion-focused, which are around trying to reduce the emotional distress that's going on. You might be trying to vent your emotions or try to think positively to fix the emotions. You might be trying to get support from friends and family about those emotions. And you can see the focus here might be different. Maybe it's more effective to deal with the emotional distress. Maybe it's more effective to deal with the problem itself. And when we talk about health-related issues, it's a really interesting question. Should we try to help people manage the emotion of a cancer diagnosis? Or should we try to focus on the cancer itself and fixing the cancer? So the questions that we're going to try to ask is which of these attributions maybe lead to these types of coping strategies? Which of these coping strategies are most helpful? And what sort of attributions help with our well-being, as we mentioned earlier? So how are we going to answer these questions? Well, surprise, surprise, we're going to a meta-analysis. As we've discussed earlier, there's basically two ways in which attributions might lead to adjustment. Adjustment's kind of our long-term goal. And maybe attributions lead to adjustment because certain types of attributions directly influence our level of distress, our depression, positive affect, our well-being. It could be, for example, that being able to control what's going on might make you feel a little bit better about the health situation. One other hypothesis about how this could be happening is that the attributions could be leading to different types of coping strategies. For example, being able to control what's going on might make you cope in a more approach way. And it could be that sort of coping that you engage in is what leads to a certain type of psychological adjustment. Roche and Weiner constructed a meta-analysis to try to identify whether this model held true. They tested this model in individuals with any sort of physical illness or undergoing any sort of medical procedure. They found 27 different studies with at least one attribution variable, like the stability or the locus of control, and at least one coping variable, how the person coped, whether it was approach or avoidance. They included a really large list of conditions, using everything from diabetes to heart attacks to cancer. You can see from all of these, there might be a combination of both genetic and environmental factors that could lead to these conditions. And so it's a really interesting question to see whether emphasis on internal or external attributions leads to a different type of well-being that might come from having this sort of diagnosis. They classified these attributions that people made in terms of the framework we've already described. Things like self-blame, effort, genes, or personality were all considered internal locus of causality. That is, the cause was inside their skin. Others, the environment, or chance, luck, or fate, they were all considered external factors. These factors were then classified also as to whether they were stable or unstable. If you blamed yourself, your genes, or congenital problems, you'd consider them to be stable. If you blamed your own behaviour, luck, chance, fate, or your effort, these were all considered unstable attributions. Finally, the attributions were classified as controllable or uncontrollable. Effort, stress, and distress were all considered controllable attributions, as well as blaming the things that you did in the past. Blaming yourself as a person, other people, the environment, or chance was all considered uncontrollable sources attributing the problem. Then the coping strategies were classified. Strategies that involved directly moving towards the problem and trying to fix that were considered approach strategies. Things like seeking information, guidance, or support, following with the medical procedure, planning, and problem solving were all considered approach-based strategies. Avoidance strategies were ones that tried to get rid of or deny or minimize the problem. Things like relaxation, disengaging from the problem or from the solution, trying to focus on other things like work or other rewards, things like TV. That would be considered a avoidance-based coping strategy. These strategies were subdivided into whether they were cognitive or behavioral strategies. Positive reappraisal, planning, positive expectancies, or optimism were all considered cognitive strategies. They were trying to think about the problem in a certain way. Actually going out and seeking information or complying with a medical procedure was called a behavioural strategy. The same thing was done for avoidance strategies, where things like relaxation or emotional discharge were considered behavioural avoidance strategies. Letting off your emotions is something you do, but it doesn't really try to fix the problem. Cognitive avoidance strategies were things that you did inside your mind to try to not think about what's going on. Things like distancing or reducing the threat that might be coming from your cancer diagnosis, for example. Finally, the strategies were classified as either problem-focused or emotion-focused. Things like problem-solving or complying with a medical procedure were really designed to try to fix what's going on. These are called problem-focused strategies. Emotion-focused strategies were ones that were around trying to make the person feel better about what's going on. This could include getting support for your emotions, or learning to accept what's happening. This classification was separate from whether they were approach or avoidance, but really looking at whether the target was around the problem or the emotion. As usual, for your long-term development, and so you can learn to start to read these meta-analyses on your own, we'd like you to have a look at the results table and see if you can identify what is working and what isn't. What coping strategies are helping with adjustment in the long run? How are the different attributions leading to different types of coping? And how are those attributions leading to the types of adjustment that we're looking for? Have a go using the table below, and then we'll try to walk you through it.